Welcome back. You know what? Our next segment is all about your health. We have Dr. Chari. She's the Director of Medicine at the Chari Health Center. Now, Dr. Chari is an internal medicine doctor. She's also board certified in hypnosis, which is field thought therapy, neuro-linguistics programming, and interactive guide imagery. Now, Dr. Chari was featured in a book called Just Fine, Unmasked Concealed Chronic Illness, and she's also an author of the #1 bestseller, Ready, Aim, Inspire. Now, her vision is to help people heal themselves through treating the underlying causes of medical and psychological conditions, including nutrition deficiency, stress, and suppressed emotions. Did I get that right?
Yes.
Welcome
absolutely.
to the show, Dr. Chari. I just wanted to make sure I got that right. Now, we're talking about pain. And you know what? I've talked to, most of my clients are over 55, and some of them have been talking about bad knees and how their stomach hurts or their neck hurts for years. What's the root cause of pain?
Well, the root cause of pain ultimately is inflammation.
Okay.
And that can be due to many different causes. There could be wear and tear of the joint, or there could be trauma, or even a lot of people don't know the nutrition they put or don't put into their body. Our bones are made of living tissue. Everyone thinks there's just a solid mass, but they're actually living, breathing tissue. And the bones and joints, the cartilage, they all need adequate nutrition. And food sensitivities is another big reason for inflammation. Because when there's swelling and pain, then that leads to lack of circulation. So we can't get the repair cells there to do what they need to do to get rid of that inflammation.
Now, many doctors have traditional methods, taking pills and stuff like that. What are the traditional methods for treating pain?
Well, there's a lot of different pain medications. One big class of pain medications is known as NSAIDs, which is non-steroidal anti-inflammatory drugs. That includes aspirin and ibuprofen and naproxen, indomethacin. There's a few others. But what they're finding now is that those class of drugs, yes, they can decrease pain and inflammation, but they can also create a whole host of side effects. And that those drugs can actually lead to a lot of hospitalizations and side effects, including ulcers, GI bleeding, as well as liver kidney problems and so many other problems.
I was going to say, as a person who played sports in high school and a little bit in college, a lot of the people that I know that actually played in the professional levels were pretty much eating as part of the meals the ibuprofen, the Advil, and so on, and they've had liver issues and stuff like that. Now, one of the big questions I want to get to, what are safe, natural treatment options for pain relief?
Luckily, there's many.
Okay, good.
And one first tip I can tell all your viewers right now is that they may be having underlying food sensitivities, and that may be causing the inflammation, including to wheat, corn, soy, and dairy. These are 4 big culprits. So I know that seems like a lot because, there are grains, but it's due to gluten in the wheat. Nowadays, there's about 90% more gluten than there was before 1960.
Oh.
That glue is what binds the grains together.
Well, you know what? I actually have experienced that personally because I'm a colon cancer survivor of about 10 years. And the doctor that I had told me to get off oatmeal and go to oat bran. And I was having, my feet would swell. And they stopped swelling after I went to the oat bran, probably because the gluten wasn't there.
Yes, absolutely. And rye, barley, all these supposedly healthy grains, which were healthy at what time, because of what's happened with the hybridization of the grains, making them shorter, stockier, having much more gluten in them, and proteins that our body doesn't recognize that creates inflammation in our gut that then leads to inflammation in our joints. So it's a big issue now.
Oh, wow. Now, what are the benefits of natural remedies for treating pain?
The benefits are they cost less, but also you don't have to worry about the side effects that you do have to worry about with some of these other medications like NSAIDs, the ones I mentioned previously. Some of those drugs, which are over the counter, they've actually been found to cause cartilage destruction and joint destruction. But you don't have to worry about that with natural remedies.
Okay, so tell me about some of the natural remedies. So, for example, as a person who played high school and a little bit of college sports and kind of gave my body to the cause, what are some of the things that I can take for, say, some of the joint pain that I get traditionally when I work out or after I work out?
Okay. Well, in addition to eating primarily a very healthy diet with organic meats, organic vegetables, fish, is to take fish oil, which has EPA, DHA, which is very important for decreasing inflammation. And then another type of fatty acid known as GLA, that's gamma-linolenic acid, that you can find in borage oil, black currant seed oil, evening primrose oil. Those are very good. But then there's some other supplements you can take as well. and that includes curcumin.
Okay, now I want to get back to what you described as meats and fishes.
Yes.
Tell me about the term you use for, did you say organic meats?
Yes.
Okay, what's that entail?
Okay, that involves ideally getting it from the farmers if you can, but otherwise health food stores where the animals are treated humanely, they have access to the fresh air, pasture raised, grass fed, and they're not fed the GMO or genetically modified grains. The animals get sick with that, and so do the humans.
So what's genetically modified grains? What does that actually really do? I mean, obviously it allows for more grains to be produced and larger grains to be produced, but what does that actually do to the makeup that doesn't make it healthy?
Well, they use very toxic pesticides, and those pesticides are released in the grain, but in our gut in the process of digestion. That creates inflammation and creates something called leaky gut. So food that is not completely digested goes back into the bloodstream. Our body literally attaches its antibodies to it, thinking it's the enemy. It deposits in our bones and joints and even other organs and causes a whole host of problems, pain and inflammation.
Oh, wow, that's something else. Dr. Chari, thank you so much, because you know what, when people get older, all these things they've been doing to their bodies for many, many, many decades are starting to come to roost. And it's important to understand those root causes, and I appreciate you coming in and spending some time with us today.
Oh, thank you. It's a pleasure to be here.
Now, if you would like to get more information on Dr. Chari and to eat healthy, to have to get rid of that pain. I know, it's not like a splinter pain, but that pain you've been dealing with a long time. Go to the Silver Hair Tsunami website. You can get more information there. You can get more information on Dr. Chari. Next up, we have Paula Shaw. She's talking about PTSD, but in everyday life. You don't have to be a military combat veteran to get PTSD, and she's talking about that with us. So stick with us. We'll be back in a moment.